Good afternoon, everyone. My name is Samantha McClure, and my topic for today will be piriformis syndrome. So my first objective will be to discuss what piriformis syndrome is. My second objective will be to explain some of the potential causes of piriformis syndrome, and my last objective will be to demonstrate a piriformis release to alleviate some of the symptoms. So what piriformis syndrome is when the piriformis muscle, which is located in the glutes, so below the lumbar area, tightens up or spasms, and it will put pressure on your sciatic nerve. So a lot of times the pain may be localized, so you'll get hip, low back, and glute pain, or it can be reverse pain that'll radiate down all the way up to the foot, and you'll usually get tingly, numbing, burning type of sensation, just kind of depending on how much pressure is being put on there. So what I'm going to do is I'm going to go ahead and use this skeleton so I can explain to you where the piriformis and the sciatic nerve are localized, so you have a visual aid and where it's at. So your piriformis muscle is going to attach to the S2, S4 of your sacral joint right here, and so it's going to run diagonal this way, and it'll attach to your greater trochanter of your femur bone, so right in here. So you'll have it run diagonally this way, and then your sciatic nerve actually combines from a couple of roots from your L4 to your S2. And so what it does is it'll come behind here and into the foramen and then shoot all the way down to the foot. And so as you can imagine, you have your sciatic nerve running through here, your piriformis muscle running right in this direction. So if that muscle is going to tighten up, it's going to put pressure on that nerve, and you get those radiating symptoms down the leg. So a lot of causes for this, you can have either underuse, injury. So underuse could be sitting down for a prolonged period of time. You restrict blood flow to the area, so the muscle will tighten up and it'll put pressure on that nerve. So that's why they recommend to you when you're driving for a prolonged period of time, or if you're sitting at a desk for a long period of time, to get up and move around so you can get the circulation going. For men, what's common for men is when they sit down on their wallets, they don't realize that they're putting pressure on that muscle, and they can get that piriformis type of pain as well. You can have overuse of an injury, so runners are prone to this, especially when they're running up hills. You can get this type of pain when you're doing pivoting motions. So if you're lifting heavy boxes up, the quick motion pivoting in this direction can tighten up the muscle, because your piriformis muscle is responsible for this pivoting motion right here. So now what I'm going to do is I'm going to go ahead and demonstrate to you a piriformis release, and I'm going to have Miss Tina come up. So I'll go ahead and I'm going to have her lie here. She's going to lie prone, so with her head down on this side, and then just scoot down a little so you can have your, there you go. Okay, so what I'm going to do is, remember, so you have your piriformis muscle that attaches about right here and at the greater trochanter of your femur, so it's going to run diagonally right in here. So what you're going to do is, with my elbow, I'm going to gently go through here, so let me know when I kind of feel that tender. So what you'll feel is like a tight kind of nodule, and the patient will let you know where there's a specific sensitivity area. So it's right in here. So what I'm going to do is I'm going to put pressure. So I'm going to put pressure, okay? About right in here. What I'm going to do is I'm going to be moving her leg side to side, so just relax. So you want to do this for about 15 to 30 seconds, just applying pressure there. Do you have any pain or pressure on your knee?
Not really.
Okay, and you just want to make sure that if you can have a patient that's had a total knee replacement, you want to make sure that this isn't causing any discomfort or pain on their knee. So just hold it here. I'm going to go ahead and bring it down, so just relax. And then just kind of massage the area. You just put a bunch of pressure on there, so you want to kind of alleviate some of that tension. So now what I'm going to have her do is I'm going to have her lie supine, so on her back. So go ahead and turn over for me. And so what she's going to do is she's going to demonstrate a piriformis stretch. So go ahead and bend both of them. There you go. And it was your left side?
Yeah.
So what she's going to do is the affected side, she's going to bring this ankle over to the opposite knee, so bring it across. And what she'll do is she'll pull her knee, so with both hands grab it, and you want to pull it towards the opposite shoulder. And so what you'll feel is it should directly stretch out this muscle right there. So you want to feel a pulling, stretching type of sensation. She's pretty tight right now, so she's not able to completely pull it. It's at your pain tolerance. All right, so you can go ahead and relax. So you want to do this 2 times for about 30 seconds, just kind of depending on your pain level. Okay, you're set. Thank you, Tina. All right, so that concludes my presentation. Do you guys have any questions for me?
How often should you stretch when experiencing this pain?
What's usually recommended is if you do it twice a day, so 2 times for about 30 seconds, just kind of depending on how much pain you have. You can do this while you're at work. You don't necessarily have to be laying down. You can do it sitting up as well. So as you're sitting down, you just bring it across and then pull it in this direction. Any other questions?
Are there treatments I can do myself at home whenever I have this type of pain?
Yes, so what they usually recommend for you guys is another form of a piriformis release is using a tennis ball. So if you lie on your back and place the tennis ball in that buttocks region where you're having the pain, you'll kind of move it around to where you get that sensitive spot, and then just apply pressure, hold it there 15-30 seconds. Again, it's up to you. And then do that 2 or 3 times, and that should help alleviate some of the pain for you. Any other questions?
How can you prevent or avoid the pain?
It's not necessarily preventable, but again, you want to do those stretches consistently, especially if you're more prone to getting this type of pain. Make sure you're lifting things up correctly. You're not moving in such an abrupt manner. And again, when you're sitting down, just make sure you're getting up and getting that circulation going to those muscles. Okay, I think that's it. Okay, so if you have any questions, these are the references in case you need to follow up with any of the information.